Welcome to the second lesson of the First Aid, CPR, and AED unit. In this lesson, we'll talk about how we respond to emergencies. There are some concerns that people generally have when they respond to emergency care. One of those concerns is catching a disease. When coming up on someone who we has seen as collapsed or on some sort of situation with strangers, we don't know what diseases they might have been exposed to or what they might be dealing with currently. So a solution to this is that we do have personal protective equipment like masks, gowns, shields, gloves being a big one that help us prevent that spread of disease from patient or victim to the responder. People are also sometimes afraid of lawsuits that they might get into as a result of giving care to someone. That's why we have Good Samaritan laws, which are those state laws that protect first responders, particularly those lay responders or just citizens who are out helping people from liability and legal issues as long as they're acting in good faith. Other concerns of providing emergency care is hurting someone. You come up on someone who is having some sort of emergency situation, you don't want to cause further harm to that victim. But the solution to this is that victims needing CPR in particular are technically clinically dead. So performing those chest compressions will only save their lives, not hurt them. And lastly, people are often afraid of making a mistake. Even if they're not trained in emergency care, we can have simple steps to follow, particularly with those cardiac emergencies, like emphasizing that hard and fast compression for CPR. If someone can just do that and call 911, they're going to give that victim a greater chance of surviving that cardiac emergency. Now, when someone encounters an emergency situation or comes up on a scene where emergency action is required, there are some specific steps to follow. The first step would be checking the scene around you, looking to see if the scene is safe. Are there any fires going on? Any electrical wires exposed? Gas, glass spills, traffic, falling objects? Those types of things are things that the responder would need to look for because they are priority number one. You think about going into a scene and giving someone care, that victim should be number one. But if the responder doesn't take care of themselves, they're not going to be able to save anyone else if they also get hurt. So you do have to check to see if the scene is safe in order to give someone emergency care. You should also look for what happened. Try to deduce from what the scene looks like, what happened and what might have caused the injury to that victim. How many people are involved? Do you need to give care to just one person? Are there several people, maybe 3 or 4 people who need care? So you do need to assess how many people there are that need that care and who is going to need the care or the most emergent care first. What's going on with that person? What kind of emergency are they having? Are they having a cardiac emergency? Are they bleeding? Are they choking? So you do need to assess that as well. And is there anyone else around you who can also help? The more responders we can have at a scene, especially when there are multiple people needing care, the more help they are going to be able to give. In particular, just even assigning someone to call 911, right? If we can say, you, sir, in the plaid shirt, call 911, and point out a specific person, that can give you all your attention to that patient or that victim that needs that care. And lastly, we need to check the person. We need to check to see if they are responding and if they are breathing. So to do this, you could tap them on the shoulder rather forcefully. You don't want to hurt them so much, but give them a good shove and shout, "Are you okay?" Look for that chest rise and fall. You could even put your ear turn your face sideways, looking for that chest rise and fall, and then putting that ear over their mouth so you can either hear that normal breathing rhythm, or maybe it's an agonal breathing, meaning that it's short and not normal, that's not a sign of normal breathing. So looking for that and feeling for the breath on your ear are all great ways to check if that person is breathing. If the victim is responsive, say they're conscious, introduce yourself and get consent to help. You always have to ask that victim if you can help them. You can explain to them that you've been trained in first aid, CPR, and AED. Would you like my help, or can I help you? That victim always has the right to deny care. You can try to explain to them, well, if you deny care, this X, Y, and Z will happen. That's okay, but you cannot give them care until you get consent from them. That is their right. If you are giving care to a child, you do need to ask a parent or guardian for permission if they are around. If they are not around, do what you can. If the victim is unresponsive, they obviously cannot give you consent. So when that situation occurs, consent is implied. So we just assume that they would want us to, perform CPR on them and save their lives and provide help to that victim or treat that severe bleeding, etc. The second thing in the emergency action steps that we take is to call. We want to call 911 or the local emergency number for any life-threatening emergencies. Again, like I said before, if there are other people at the scene, we can ask them to call for help so you can give all your focus and attention onto that person who needs your care. If you are by yourself, you can call 911 before you start CPR or get an AED machine. You can also do that now that we have speaker phones. You can do that while you're doing those things. So calling 911 on your way to the AED machine and starting it up as you are still on the phone with 911. And you want to give the operator the correct information about your location, the victim, what's happened, and any other vital information that you can. Typical questions that an operator for 911 would have would be like, what's the emergency? What is the address for the emergency? Is the victim conscious? Is the victim breathing? And what's happening now? The 911 operator may also give you directions such as stay on the line until I tell you to hang up. Rescuers are being sent to your location. Please meet them and direct them to the scene. Or they may direct you to begin doing CPR and we'll talk you through it. Some tips when calling 911 include not hanging up. You don't ever want to hang up on 911 unless they tell you to or until EMS arrives. Answer any questions in a calm manner. It doesn't help anything when we are kind of panicking and freaking out. So staying calm in those situations, which is sometimes very hard to do, especially when it's an emergency situation. But staying calm can help them answer questions you have and give you the correct steps that you need to follow. Know the address of where you are or the landmarks of where you are located. Describe the situation with what is happening, not what you think is happening. Put the phone on speaker so that you can assist the victim if you are alone, and direct someone to call 911 if you are assisting the patient. And then the last emergency action step is care. So after checking the scene, checking the person, calling 911, you want to give care to that person until that EMS personnel arrives. You don't want to do any further harm to that victim. You don't for sure want to abandon that victim, so stay with them even if you're just there to simply calm them down and reassure them that help is coming. Monitor the person's breathing and consciousness. This is important because if either of those things stop, for example, if they stop breathing, if they become unconscious, you may need to perform CPR. So sometimes going and getting that AED is a good idea just in case. Help the person rest in the most comfortable position. Keep them from getting chilled or overheated. Reassure the person and give them any specific care that they need. So here is a video of everything we have covered so far. Now, let's say the victim is unconscious, but they're breathing normally and has no other life-threatening conditions. We can place them in what's called a recovery position. And the reason we want to place them in this position is it ensures the airway of that victim remains clear and open just in case that person vomits. If somebody vomits, we don't want them to choke or breathe that back in and choke on it because that could be a potential cardiac arrest situation. So putting them in this position will allow that or prevent that from happening. The recovery position is also a great position for someone to put that victim in is if they need to leave them alone to go call or get additional help. Now, there are some steps a person can follow to put that individual or that victim into the recovery position. When kneeling next to the victim, you want to bring that victim's arm that's closest to you upwards. Then you want to lift the victim's leg farthest from you straight up, so it is bent at the knee. Place one hand on the victim's shoulder and the other hand at the victim's waist, and then gently roll the victims towards you and try to get them to keep their head stabilized if possible. You want to adjust the body to keep it stable, so you want that hand underneath that cheek to kind of prop that head open, and you want to position that victim's head and mouth towards the ground to prevent them from aspirating. So if they do vomit, it goes down onto the ground, not staying on their hand for a potential aspiration situation. Here is a video, so another visual of how to put someone into that recovery position. Now, let's say you come upon a scene where a victim is in an unsafe scene. If a victim is found in an unsafe environment or is in imminent danger, it may be necessary to move them out of that environment as soon as possible. But you do want to take care of yourself. If it is unsafe for you to enter that environment, then you do not want to enter. But if you are able to get them out of that danger, you should. But you do want to take extra precaution in moving that victim if you suspect they're suffering from a spinal cord injury. We don't want to do any further harm to someone who has a spinal cord injury, so we have to move them very, very carefully. Some ways we can remove a victim from an unsafe scene are a walking assist. If that victim is able to walk off the scene themselves, we can certainly assist them in doing that. We can also grab the top of their shirt and drag them, that shirt by the shoulders. We can drag them by the ankles, or we can wrap them in a blanket and drag them that way. This is the end of responding to emergencies or check call care. So now that you've learned about how to respond to emergencies, please go to the First Aid, CPR, and AED folder and take the quiz.